Hello, hello. Well, I'm making this video for a few people in particular, but there's some really good stuff here. Sorry for the dog, but she did go back when I told her to. And the bunny's going to visit me from time to time. I'm just doing some stretching, feeling good. I have two blocks as my props. I also have a strap to my left that you can't see. So we're going to come to this position. It's often called constructive rest or hook line position. Feet are about hip width apart. Toes might turn in a bit. You can take your hands under your bum with your forefinger and thumb making a diamond so the forefingers point down, and then you can get a bunny butt in your face as you do this. So as you inhale and exhale, you may feel different types of pressure under the fingers. This is just sort of a tactile way of checking for whether or not your lumbar spine is moving up and down and pressing in evenly. I chose to take my arms out. So as you inhale, the heart rises, lumbar lifts, and as you exhale, you may feel sort of that dropping of the pelvic floor. I'm doing some little spinal twists here because I found out that my SI joint was a little sticky. So surprise therapy for you. And then I start to push my legs away. If you push your legs away on the inhale and exhale, letting the heart rise, lumbar lift, and then dropping the pubis to rise it up towards the navel, ribs, heart, you can get a nice traction. But anyways, let's continue with inhale, heart and lumbar lift. Exhale, pelvic diaphragm lifts, low back gets flat. And you may notice that if you articulate your spine and you allow the limbs, particularly the arms, shoulders, head here, to move with the spine, you'll see that the head naturally moves with it. I was not actually trying to articulate my cervical spine there. It was going along with what the rest of the spine was doing. So here I have the block in between the thighs. Closer to the knees is always nice. You don't have to have the block for this exercise. But what I'm doing here is I'm playing around with inhaling, letting the spine articulate, heart rising, and then as I exhale, I drop the belly and pretend like I'm going to lift the feet. Now, if you have acute issues with any of your abdominal muscles, spasming, anything like that, you may want to try this one foot at a time. You pretend to lift one foot. There I actually lifted my foot. So I'm just playing around, but you might just want to keep pretending that you lift the whole foot. So it doesn't mean lift part of the foot. It means pretend like you're lifting the foot so the pressure gets lighter. As you exhale, the belly drops like a little basin of water down towards the earth and rises towards the heart center. As you inhale, the belly fills up, back body fills up, and then the tail and the sacrum get closer to the ground. So with the block, you can also try the trick of inhale, heart up, sacrum gets flatter, and then exhale, pretend to drop the block, but don't. Just lighten your pressure in the block. Now you have to do this without your knees coming apart. So you have to play with the idea of trying to drop the block, not by your knees coming apart, but by you releasing that squeezing sensation in the inner thigh and also in the back body, in your glutes, in the muscles around the low spine. And even I still struggle with this. Probably about 80% of the time I kind of get it. But as you inhale, that inhale stays the same, heart rises, back arches. Exhale, feel the pelvic floor lift and drop towards the earth. Try to release the pressure off the block. Maybe even think about spitting the block down towards the floor where your heels are. You could go on and on with this. You could actually take all of the exercises together, So inhale is the same, right? Lift the heart, press the feet, press the sacrum, exhale. Drop the low belly, drop the lumbar spine towards the floor, pretend to lift the feet and drop the block at the same time. You can actually, again, lift the feet. Then you're going to come to the wall, same exact premise, except this is really good if you're in a more acute phase of resolving some spinal issue due to the muscles that connect to the spine, like your psoas is spasming, or your, it could be your QL, it could be deeper issues in the hamstrings, for instance, being tight and pulling down at the sacrum, things like that. So here we're going to do the same thing. You inhale and then exhale. Pretend to lift the feet off the wall. So you feel just the skin maybe barely touching the wall, with or without the block. And now I'm palpating the muscles inside of the bony hip points. What I'm trying to do is I'm going to lift my legs a few times and I'm going to feel the muscles engage and get kind of hard, and they might feel like little ropes that are lifting and maybe even puffing out of the belly. And then what I want to do is, one at a time, I want to pretend to lift my foot and not feel that engagement. And then I'm going to pretend to lift both feet and not feel that engagement. So what I want to do is I really want to tap into the muscles that are closer to the spine, and I also want a little pelvic floor work, just a little. If you do too much, you'll notice that your pelvis tucks under, your tailbone points towards the sky, and when you go to lift your feet, you'll feel all this work in your hip flexors. You're trying to palpate no work. You don't want to feel any muscles flex or bulge under your hand. And in order to do this, it's going to have to be a little that sensation of when you lift the leg, you finally get to lifting that foot off the wall, that sensation of wide space in between the upper inner thighs, where that block was, where we were trying to drop it but not drop it. You'll want to hug the knees in at some point. You may even want to push your thighs away from the hip sockets as you do the breath, the inhale, rising of the heart, exhale, dropping of the belly, lifting of the spine. It can give you a little spinal traction. Might feel pretty good. The wall work is definitely best if you're doubting your strength, if you're just building your strength. So here I'm doing a little Gomukhasana. I'm grabbing my ankles, and I might even grab my outer feet. But for you, just grabbing the knees and the chest and pulling the feet closer to your sit bones might be your remedy. And then if you turn the toes in a little bit as you straddle, that can access some different areas. So this is just a bit of a stretch and a little counter action, because if you are accessing your butt muscles and your back body to always engage your legs and your spine instead of the deep core muscles that run from the top of your foot behind your shin, inner thigh, connecting to the inner smaller part of your femur bone, and then sliding up by the front of the pelvis, diving deep and even interacting with the connective tissue and viscera of the lower organs, reproductive organs for us women folk. And slide along the spine, connecting to the spine and the breathing diaphragm. All of that stuff, so important to be able to activate it consciously. Here comes the strap. Strap loops around. I'm doing it in a kind of less like injury prevention way. What I might do is strap up my legs before I get the block under my sacrum. So you can keep your legs bent here in that constructive rest position, or you can let the legs slowly straighten. Notice I didn't just shoot my legs out. I wanted to make sure I knew where my body was. With the legs strapped above the knees, you're looking for the knees to point up and slightly inward, depending on your body makeup. If when you stand with your toes pointing forward and your knees naturally point out away, then pointing up is fine. But if your knees generally point forward or in, then you want them to point in. You could get attacked by a bunny while in this position. I can't guarantee that one won't come out ready to conquer your equipment, your strap, your block. But just do your best to breathe through it. And when he tries to eat your hair, just pretend like it's no big thing. And then here, I'm doing is I'm bracing my legs against the strap on an exhale. So when I inhale, I'm just filling up the body. And as I exhale and I drop the low belly, I brace against the strap like I'm trying to break it. But I'm not going 100% and going crazy. I'm just doing about 30 or 40%. That's one of my sneaky ways of giving myself a little adjustment in my SI joints, which were bugging me a little bit today. And then legs up. You can, of course, scoot around, get your butt and back of your legs up against the wall. But having the strap there is good. It means you have to engage less, and you can just let gravity do its thing and the strap do its thing. So what we're going to do here is we're going to palpate the psoas. Now you can put a blanket or a towel over this block if it's too harsh. So I'm taking the edge of the block below my ribs, so it's between my ribs and my asis, my frontal hip point. And I'm leaning into it because it's not on my belly button. It's between my ribs and my right frontal hip point, next to the navel, and I'm just leaning onto that side and getting some stuff moving in there. And you'll want to breathe normally into this. For me, I don't feel very much sensation at all, but thankfully I don't have any known issues anyways with my psoas muscle. But this is good to do for anyone because without a doubt, one of these muscles is going to be shorter, tighter, maybe even unconsciously it gets used and tensed more than the other. So it would be good to notice if one side had more sensation than the other. And you'll notice other things start to release too if you stay long enough. And then from there we're going to do just a quick cat-cow. Those of you who have been to my classes will know that when we go hands and knees and I have you untuck your toes, we talk about, yes, you can put the block there too. You can use that as an afterthought. Spitting the block back, so you're going to drop it. So when you inhale, try to press into more than just the knees and the heels of the hands. It's fingers and hands. It's your shins, the top of your feet, the top of your toenails. When that happens, you'll notice that there's a difference in the space between your two frontal hip points. The space between the two frontal hip points, pelvic diaphragm, should gather inward and sort of lift. If you're only using your knees and you're not actively pressing your feet into the floor, chances are you're going to be acting more from the outer body, from the back body. Outer body meaning the more superficial core muscles that don't actually stabilize the spine. So as you cat-cow, you can tuck your chin in or you could leave more length. It really all depends on what you're working. I would recommend anybody with any acute back issues at all not go a lot for the chin tucking technology. You can come to a down dog for a moment. Again, the block's there. You can sort of press the inner thighs away from each other and yet feel this zipping up of the inner thighs towards the hip creases and the pelvic area. When you come up with softness in the joints. Weight equally, heels in front of feet. Maybe more in the front of your feet. I like to wave it And then again, I keep that width in my sit bones, like I'm trying to drop a block. I might even give birth to a block. I don't know. And then as you rise, sides of the low spine start to rise and kind of meet right under the ribs, and the ribs close in towards one another and rise towards the heart. And then victory and a little sassiness.